Are you 65 or turning 65 soon? Then you need to give Medicare expert Myriam and her dream team at United Insurance Experts a call today. They specialize in Medicare and will guide you in making the right choice for your specific needs. One plan doesn't fit all. United Insurance Experts offer you choices: Blue Cross, Humana, Aetna, United Healthcare, and many, many more. Call Myriam at United Insurance Experts at 561-464-CARE. That's 561-464-2273. Medicare can be very confusing. Myriam is here to help. Call Myriam today at 561-464-CARE. That's 561-464-2273. Myriam will educate you with no obligation on your part. Or visit UnitedInsuranceExperts.com. 561-464-CARE or UnitedInsuranceExperts.com. United Insurance Experts is headquartered in Boca Raton and licensed nationally, speaks English, Portuguese, and Spanish. Good morning and welcome to Medicare Made Simple with Medicare Myriam and her co-host Traci from Smart Caregiving. Medicare Made Simple is brought to you by United Insurance Experts. Call today 561-464-CARE. That's 561-464-CARE. Now here are Medicare Myriam and Traci with Medicare Made Simple.
Hello everyone, my name is Miriam Leyva. I'm the owner of United Insurance Experts located in Boca Raton. Before I start, I would like to share with you a little history about me and the purpose for this show. I've been in Florida my whole life, born here, raised here, got married here, and raising two wonderful girls ages 10 and 3. Not planning on leaving Florida anytime soon. I love my hometown. I've been in the financial industry for 15 years. Over the course of 7 years now, I've been specializing in Medicare. The purpose for the show is to provide education, clarity, guidance, resources, and to have a better understanding on what Medicare can do for you. Our goal is to take the confusion out of Medicare. Know this show was not only created for soon-to-be 65-year-olds. This is for all people that want to learn about Medicare. You could be a son, a daughter, a niece, a nephew, a caregiver, someone that has been on Medicare for years and is still confused, or just someone that needs a refresh. I know Medicare can be confusing, overwhelming, and sometimes frustrating. A lot of this is because you're being bombarded with emails, mailers, TV commercials, and I know you've seen the TV commercials. And maybe even unsolicited door knockers. You're getting all kinds of information thrown at you from different directions, and it's hard to know what's the best route for you and who to trust. If you signed up for Medicare before your birth month, your coverage should begin the first day of the month you turn 65. My advice to you is don't wait. If you know you want to get on Medicare, 6 months prior to your birthday, start learning. Start getting that education. Start learning all your options because there are options out there. And you're not alone. I'm here. If you need to call me, if you need to, you can email me at questions@unitedinsuranceexperts.com. I'm here to guide you. So my advice is make sure you prepare 6 months prior. So 3 months prior to your birthday, you can start the enrollment process. For those that are already collecting Social Security benefits prior to turning 65, you will automatically be enrolled in Medicare Parts A and B. You should be receiving your red, white, and blue card in the mail. Saying that, let me quickly give you some advice on Medicare junk mail. It can be very difficult to tell which mail is actually important. Please don't throw everything away. Just set it aside and go through it carefully. You have no idea how many times I've had people call me and say, Miriam, I have not received my Medicare card. What is going on? My birthday is in a few days. Where is my Medicare card? Well, let me tell you. Turns out to be they threw it away thinking it was junk mail. So please just set it aside and go through it carefully because it could be your Medicare card or it could be a letter from Social Security. So today I'm going to go over the basics of Medicare. What is Medicare? How and when to enroll? What are the parts of Medicare? Medicare costs, Medicare supplements, also known as Medigap plans, and Medicare Advantage plans. Let's start. What is Medicare? Medicare is a federal health insurance program for people 65 and older. Under 65 and receiving Social Security disability insurance for a certain amount of time, or under 65 with end-stage renal disease. When and how do I enroll in Medicare? Your initial Medicare enrollment period is a 7-month window. It begins 3 months prior to your 65th birthday and ending 3 months after your 65th birthday. For those not collecting Social Security benefits, you can enroll online at ssa.gov/Medicare, or you can call into Social Security at 1-800-772-1213, or you can visit your local Social Security office if it's open. Now, my advice is to go to ssa.gov/Medicare. It is the quickest way. If you need help enrolling, you can email me at questions@unitedinsurancexperts.com. I can help you. I can guide you. We could do it by fax into Social Security. Just give me a call. I can help. Once enrolled, you have Original Medicare, which is made out of 2 parts, Part A and Part B. Part A covers your hospital stay, your skilled nursing facility, pretty much all the things that you need in a hospital or a skilled nursing facility. Part B is a medical insurance. It covers your doctor's visits and services. Other examples are outpatient care, clinic visits, ambulance services, preventative care, etc. For most, Part A is premium free after 10 years of work. Other costs could include a deductible, some copays, or coinsurance. Part B does come with a cost. This is surprising to many. For 2022, the standard Part B premium is $170.10 per month. For many, the Part B premium could be higher. There are other costs with Part B, like some copays, deductibles, and coinsurance. If you decide to only stay with Part A and Part B, which is Original Medicare, also known as Traditional Medicare, it does not cover everything. You pay 20% coinsurance and Medicare pays 80%. So please know that if you stay with Original Medicare, there is a gap that you will be responsible for. This is where Part C comes along. Part C is also known as Medicare Advantage Plan. They're offered by private insurance companies, and I'm sure you have seen the commercials, like I said it earlier in the show. They run all the time, constantly. They're telling you, you get a Part B credit, you're getting dental, you're getting hearing. Those are Medicare Advantage plans. They cover everything that Original Medicare covers, all of your Part A and Part B benefits, and most offer additional benefits like prescription drugs, dental, and hearing, and etc. Most Medicare Advantage plans are 0 premium. Other costs could be copays and deductibles and coinsurance. One important thing to know about Medicare Advantage plan is that they're required to set an annual maximum out-of-pocket limit. Once you reach that limit, the plan will pay all of the costs for the remaining year. Now let's talk about Part D. You can get Part D in 2 ways, through a Medicare Advantage plan or a standalone Part D plan. The standalone Part D plan could come with copays, and it does come with a premium. Now let's talk about Medicare supplements. Medicare supplements, also known as Medigap plans. Please know that these plans run from letters A through N, varying in different coverages. Of course, our most popular letter is G. Most of you have heard of Plan G. Know that these are standardized. They're the same coverage everywhere. Okay? So this is important to know because I've had people come to me and say, no, I have Plan G with such and such company and I pay such and such amount, and they don't realize it's the same coverage. You just have to shop the best rate. Please know that United Insurance Experts is contracted with multiple companies around the nation, and we can shop the best rate for your Medicare supplement. Like I said, the Medicare supplement plans are standardized. They're the same identical plan. There's only 2 different things that you have to look at. 1 being the rate, 2, the customer service. Please know you can reach me for anything regarding Medicare at 561-464-CARE. That number again is 561-464-CARE. 2273, or you can email me at questions@unitedinsuranceexperts.com. That email again is questions@unitedinsuranceexperts.com. Before I introduce my co-host, I would like to tell you a short story on how I met Tracy. Before I introduce my co-host, I would like to tell you a short story on how I met Tracy. Even though I have many years of experience in Medicare, I never had firsthand experience until my mom was diagnosed with cancer and I became her caretaker. And one of my colleagues recommended I speak to Tracy. Tracy has been such a blessing to our family. She has recommended resources I had no clue existed. But let's hear it straight from Tracy herself.
My name is Traci Lamb, and I am the CEO and founder of Smart Caregiving. And I created a company about 3 years ago. After working in hospice for about 15 years, I saw there was a really big need in the healthcare industry. A lot of people take care of patients at home, moms, dads, special needs children. And I, too, am a caregiver. I took care of my dad up until this past February when he passed away, and I take care of my mom. And there really was no, for lack of a better word, one-stop shop for people who take care of a loved one at home to be able to get resources and find out about resources, and also actually be able to call in or email in and actually ask questions and be able to say, this is what's going on with my mom, or this is what's going on with my dad. Can you tell me companies that could help me to do different things? And so since there was really no company out there like that, I thought that was kind of crazy, since I'd been in the healthcare industry for 20 years and I knew about a lot of different companies that were capable of doing that. So I went ahead and I started my company. And that's basically what we do. We basically bridge the gap. We connect anyone who takes care of a loved one at home worldwide can contact us. They can email us, or they can contact us through our toll-free number. And they can let us know, get on the phone and say, this is what's going on, and this is what I need help with. So that's basically kind of what we do. I'm spotlighting today 2 or 3 companies that are just on my directory. I have a global directory of companies that offer products and services that can help those people. I'm going to go ahead and spotlight those 3 just to tell a little bit about them. The first one would be a company called elderhelpers.org. elderhelpers.org. One of the biggest questions people have is they're going to work, they need somebody to stay with a patient for a while, and they can't afford to pay $20 an hour every time they do that. Elderhelpers.org is a completely volunteer organization. All you have to do is plug in your zip code, and you will get a list of volunteers that have been background screened, so you can trust that they are going to be safe in your home and with your patient, and they will not charge you anything. They're volunteers. It's a wonderful, wonderful organization. They are nationwide. The second organization I want to talk about is a company called sitinstand.com. It's SIT, the letter N, and then the word stand, STAND.com. They have come up with a product that my father personally would have killed for if I had known about it, again, before he passed away, but I did not know about it. This is a product that my father was heavy, and he got to where his legs were very weak towards the end. And so he had a very hard time going from a sitting position on a couch or in a chair to an upright position. Sit and Stand is a product that is sold on Amazon, by the way. You can find it on Amazon or MedMart. And it will actually, the person can be sitting on the couch, on a chair, in a dining room, wherever, and it will lift them all the way up and help them to stand. That is a huge, huge product. I cannot stress enough how wonderful a company that is. Like I say, my father would have killed to have that product. It was enormous. It would have been an enormous help to him at the end. The last company I would like to highlight is a great company, been around since 2014. It's a company called Tactical Rehab. Their website is tacticalrehabdme.com. tracytrsmart-care-giving.com. This is a company that actually helps military vets. They're currently helping military vets. They're getting ready to start helping the people that aren't vets as well, but they currently are helping vets. They have a product that is phenomenal. It's called Custom Orthotics. And their website, so that you know, is tacticalrehabdme.com. You can also go to my website. My website is www.traci, Traci, knows.com, or www.smart-caregiving.com. Either one will take you to my website, and just click on caregivers, register to become a caregiver. It's completely free. It's always completely free. And then you'll get access to my global directory, and all of these companies are on my directory. Sit and Stand may not be, because I literally just got them a week ago. But Tactical Rehab they are custom orthotics, and those are shoe inserts that you can put that are made, they actually come out to your home, and they custom mold your feet. And this helps so much. These have been made specifically in the past for the military. It helps so much with your back pain, with hip problems, with knee problems. It is night and day different, and these custom soles that they make can slip into any of your pairs of shoes. They're absolutely 10 million times better than anything you can buy over the counter or in the regular everyday market. They are absolutely positively wonderful, and I cannot recommend them highly enough. So those are just three of the companies that my company represents. But every week we will be taking email questions. So if you have any questions about something that you would like me to tell you about a company that can help you with, or answer any questions that you have, I will be more than happy to do so.
Yes. Also, know you can go to my site, UnitedInsuranceExperts.com, and there's going to be a tab, and it's called Smart Caregiving, and that will direct you directly to Tracy's website, where you can sign on and look at all these wonderful partners.
Yes, and that's fantastic. And like Myriam has said, we are partnering with various companies that can help you. There are companies on there that can help you with your finances. We have a company that has a patented bed sore pillow. So if you have problems with bed sores, there is a bed sore pillow that has been patented. All of these are different kinds of companies that I know that after, again, working in the hospice industry for a really long time, I knew these were products and services that people wanted, that people needed, and it could just be a one-stop shop, and people could understand that we are there for you. You can join a smart caregiving community, become a smart caregiver, so you don't have to work so hard, so you don't have to be wondering, well, what do I do now? How can I get help? Who can help me? I'm alone in this. You're not alone in this. There are 53 million people worldwide that are dealing with the exact same thing you are.
I'm one of them, Tracy. I'm one of them.
Absolutely.
I felt that. I felt that myself when my parents were diagnosed with cancer. I felt alone. I felt that I didn't know where to go. I mean, you guided me with some programs that I didn't even know existed. So thank you, Tracy, for.
Oh no, you're welcome. You're welcome.
All your help.
No, you're welcome. And I think what you guys do is phenomenal as well. The reality is that Medicare and Medicaid are two very, very difficult programs that the government runs, and half of the problem too is education, as far as what Medicare covers, what Medicare doesn't cover, what Medicaid covers, what Medicaid doesn't cover, and everybody just automatically, unfortunately, assumes that, oh, well, I've got Medicare and Medicaid and it's all covered. And unfortunately, that's incorrect. And I didn't know that either. I didn't know anything about all of this. It's like maybe one show we'll talk about a little bit about hospice care. Hospice care is one of those words that it's just like, the plague.
Yeah.
People say hospice and they run, and they're like, oh no, we call hospice in 3 days before someone passes, and that is so not true. I thought the same thing before I worked for them, but it's just so not true. My father was under hospice care 3 different times before he died, and one time he was under there for 2 years. So what people need to understand is this is going to be an educational program. It's going to be Myriam educating about anybody having questions about Medicare and Medicaid and all of those different things, because there's a ton of nuances that go into all of that. And then it's going to be me answering questions as far as all the different nuances that people come into when they're caring for any kind of loved one at home. And the reality is that no matter who you are, no matter what age you are, caregiving will eventually come into your life. Somebody will eventually need it, and that's what we have to know.
That's
and
correct.
That's why,
And that's why we're here. And please email us at questions@unitedinsurancexperts.com. If there's any topics you want us to discuss on the next show, please let us know. We would definitely, right, Traci?
Absolutely. Absolutely. We want to know. We want questions. So give us all your questions, all the things that you've been afraid to ask, that you didn't know who to ask, all the things that you were not sure about. Like I say, questions about Medicare. What does Medicare cover? What does Medicare not cover? What does Medicaid cover? What can we do about, somebody being able to help as far as taking to appointments or different things like that. There's a gazillion different kinds of questions that are out there, and we're counting on you guys to give us the questions. I know a lot of the questions just simply because I deal with caregivers on a daily basis. And Myriam knows a lot of questions because she deals with Medicare on a regular basis. But we want to hear from you guys as well. We want to hear what all you guys have to say, for sure. Thank you so much for being with us today. We have really, really enjoyed it. We are super excited about being able to come to you each week and be on the show each week. Please feel free to contact us and write us those questions at unitedinsurancexperts.com. And Myriam's website is unitedinsurancexperts.com. And again, my website is www.traci, knows.com, or smart-caregiving.com, either one. All right? And we are super excited and have a wonderful day.
Thank you, Traci, and thank you for listening. I'm Medicare Myriam, and I'll see you next week.
Thanks for listening to Medicare Made Simple with Medicare Myriam and Tracy right here on Legends 100.3. Medicare Made Simple is brought to you by United Insurance Experts. For more information, call 561-464-CARE. That's 561-464-CARE. Tune in next Saturday at 9 a.m. for more Medicare Made Simple with Myriam and Tracy. Are you 65 or turning 65 soon? Then you need to give Medicare expert Myriam and her dream team at United Insurance Experts a call today. They specialize in Medicare and will guide you in making the right choice for your specific needs. One plan doesn't fit all. United Insurance Experts offer you choices: Blue Cross, Humana, Aetna, United Healthcare, and many, many more. Call Myriam at United Insurance Experts at 561-464-CARE. That's 561-464-2273. Medicare can be very confusing. Myriam is here to help. Call Myriam today at 561-464-CARE. That's 561-464-2273. Myriam will educate you with no obligation on your part. Or visit UnitedInsuranceExperts.com. 561-464-CARE or UnitedInsuranceExperts.com. United Insurance Experts is headquartered in Boca Raton and licensed nationally, speaks English, Portuguese, and Spanish.